What's up, everybody? Welcome to this week's episode of the Well Man's Podcast. My name is Bryan Brozy. I'm joined by my friend and co-host Keoni Tita. Keoni, how are you today?
I'm doing wonderful. Thanks everybody for once again listening to us. Today we have a pretty special podcast. We're going to talk about kidneys and actually specifically more kidney health or chronic kidney disease.
Okay.
And this is really important to me, especially as a traditional Chinese medicine practitioner, where the kidneys are kind of thought of as, you know, the most important Chinese organ there is. But from a Western point of view, I can also make a case of it being one of the most important organs also based on the functions that it does. And I don't think the kidneys get enough attention because they're quietly doing what they're doing until, you get a blood test that says otherwise, that you need to, get some help
Right.
and have some sort of support for them. I think a lot of people think of the kidneys as just, something that filters the blood and then creates urine and it's kind of a filtering system, but it does so much more than that. And so I want to go into the importance of that. And one of the main organs that is the first to get damaged from, just everyday chronic disease are the kidneys. And so we're talking about people that have blood pressure issues. The kidneys will suffer tremendously. People who are constantly are on a ton of meds, the kidneys will suffer from that too, especially like long-term NSAID use. But there's lots of drugs that have to be metabolized and filtered through the kidneys that can cause damage there also. Kidneys are one of the few organs in the body that can actually produce glucose from do gluconeogenesis, the liver being another one. The kidneys are another important one, as well as the intestines, and that's it. So that's pretty cool. So it says something about helping with sugar balance too. And some other things the kidneys do, and we'll get into more detail with this, is it also helps to regulate your red blood cells. It creates a hormone called erythropoietin, which talks to your bone marrow to help you make red blood cells. So, if you have chronic kidney disease, you may show up as anemia first. And then also the kidneys will help convert a form of vitamin D into its most biologically active form. So the kidneys are used for that too. So those are just some of the things that the kidney can do.
Right.
Now, the most likely cause of chronic kidney disease, and when I say chronic kidney disease, I'm just talking about, any disease of the kidney that is a detriment to the kidneys, and over time it can create kidney failure. So chronic kidney disease is kind of this catch-all phrase for a lot of kidney ailments that can ultimately lead to kidney failure. So
before we get into kidney disease, Keoni, I was curious, and obviously I can allude from a few of the things you mentioned there, but can you talk about the Chinese perspective a little bit as to why it is looked at as possibly the most important organ in your body?
Yeah, well, one of the main things about the kidney is, from a Chinese perspective, it's kind of, without going into detail, you can think about it as the seat of yin and yang. Now, it's stereotypically known as a yin organ, but the seat of yin and yang. And why that's important, if you ever see that symbol, yin and yang, the whole concept of Chinese medicine is you have to keep yin and yang in balance. The kidneys are really, really important for doing that. If yin and yang are not in balance, a lot of times it will show up in the kidneys, and the kidneys kind of not only help keep it in balance, but when you have significant yang deficiency or yin deficiency, or yin and yang separating, which is diagnostic from a traditional Chinese medical perspective that you're close to death, it's the kidneys that are trying to balance yin and yang. So without going into too much detail, that's one of the main reasons why it's the most important. You can also think about it from a Western perspective. In Chinese medicine, they didn't really know about the adrenal glands, and the adrenal glands sit on top of the kidneys. And what's really interesting is you can think that in traditional Chinese medicine, the Chinese kidneys are a combination of the adrenal glands and the kidneys. So you can think about
Mm.
everything that the adrenal glands do for, like, helping control stress hormone, to helping control mineral balance, helping control sex hormones, and things like that. So in Chinese medicine, the kidneys kind of do all of that, so
Yeah.
it's considered one of the more important organs, especially in traditional Chinese medicine.
Yeah. And then I can imagine blending with your experience as well, just everything you listed off there is involved, or what we're alluding to just in medications, our diet, it's going to filter out a lot and have a huge role, especially as we encounter more and more toxins like medications and things like that on a very regular basis.
Yeah, and you're not, yeah, no kidding. And it's a great point, because one of the things that shows up as chronic kidney disease is people using non-steroidal anti-inflammatories, NSAIDs, or like
Mhm.
acetaminophen, Tylenol, and just using it over time can cause damage to the kidneys. The kidneys have to help detoxify these organs, but it can lead to kidney injury, and ultimately can lead to, if it's not controlled, to kidney failure. And the other thing that you also talked about is there's also correlation with the kidneys being compromised from everyday toxins, right? So if you have any type of like organic, volatile organics in your drinking water, or just environmental pollution, the kidneys are one of the organs that help detox it. And if they're overwhelmed with these toxins, even not from just an acute uh, level, but from a chronic level, your kidneys can be compromised, and it can lead to chronic kidney disease.
And last but not least, it's not yang. It's not yin and yang. Like I've been saying my whole life. Is that correct? It's
You
yin and
know what?
yang.
I've heard it said both. Yin and yang, yin and yang. It's nobody's gonna say anything to you about that. I may be saying it wrong, but anyway, I've heard it both.
Okay. All right. All right.
Yeah.
I'll keep doing what I'm doing then.
Yeah, yeah. One of the main factors that cause chronic kidney disease, it's diabetes and high blood pressure. So just real quick, you can think of high blood pressure. Too much pressure coming through the kidneys will destroy the kidneys, right? It's a filtering system. So if you have too much pressure in a filtering system, the filtering system doesn't work very well. And then from a diabetic perspective, you just think about it as, excess blood sugar creating ages, right? We talked about advanced glycation end products. Basically, these things rust the kidneys and the body from the inside out. Well, the kidneys are particularly prone to it. People with diabetes, especially as it's progressing, it will show up damaging the kidneys. A lot of times before you see anything else, it can show up on a blood test really easily. So
It's
those are the main things. So keeping your blood pressure under control in diabetes is huge.
Yeah, it's nuts to me, Keoni, because these are all it's, such an opportunity for me to learn. As I'm sitting here, I see so many patients in like their 30s and 40s, hypertension or diabetes or one of these kind of, obviously there are some factors, but really lifestyle related, especially depending on type of diabetes, really lifestyle related diseases. And then seeing those, and then when I look at like a chart for 50, 60, 70-year old, seeing those plus CKD, and then now
Mm-hmm.
being able to kind of put these two together, see how you kind of lead yourself down that path or set yourself up
Yeah.
for it.
Right. And
um
and the older you get, Bryan, the older you get, the more at risk you are for chronic kidney disease. So a risk factor is age by itself.
Sure, sure. It's just really standing out to me just in how much I do see. And then it's putting these pieces together. If I go work PRN at a SNF, I probably evaluate 6 or 7 brand new people. So you just get all this, you just look over a chart quite a lot and to see,
Mm-hmm.
see quite a few charts where 30s or 40s, we look like this. And then we start adding the
Yeah.
CKD and things like that, that
Yeah.
clearly weren't aided by the hypertension or whatever the case it is
Right.
earlier on.
Right. And so to your point, 1 in 10 American adults is living with chronic kidney disease.
Mm,
right? And it's the ninth leading cause of death in the United States.
mm.
So CKD is the ninth leading cause of death in the United States. That's huge. And think about that in, combination with, all the chronic diseases kind of partner up, right? So diabetes
That's yeah.
and CKD, heart disease, CKD, dementia kind of falls in there too. Cancer falls in there too. So these things, when you see some indication of, the kidneys being, damaged, or seeing some blood indicators of that, and we'll go over that a little bit. You really have to look at the body in a holistic way to make sure their blood sugar is under control, make sure their blood pressure is under control, make sure they're, living a lifestyle that can help preserve kidney function. So, um, let's see. I wanted to go over just like the structure and function of the kidneys real quick. 'Cause I'm not sure a lot of people will know about that. But anyway, the kidneys have many tasks. One of the main ones is just influence in water and fluid balance. It helps regulate blood pressure, and of course it helps eliminate waste. The kidneys are highly metabolic. They receive about 1/4 of the cardiac output of blood supply. The main functional unit of the kidney is called the nephron, and in each kidney we have about 1 million of these. And the nephron has two distinct parts. One is the glomerulus, and that's the actual. You can think about that as the filter, and then also the renal tubule, and it's just a little tubule, it's a little channel that's specialized in, reabsorbing electrolytes, getting rid of waste, and keeping what we need. And then from there, once it's filtered, goes to the renal tubule, goes into collecting ducts, and then eventually the fluid will go into the bladder, where, at some point the person will urinate it out. And the kidneys are going to get rid of minerals that it doesn't need. It's going to get rid of waste products it doesn't need, and it puts it all there for it to be excreted. So one of the big biggies is blood pressure regulation. And the kidneys actually release another hormone in there that a lot of people may not know. It's called renin, and it just basically initiates a series of reactions that produces a hormone called angiotensin. And what that does is constrict blood vessels, and it will increase, therefore, when it constricts, it will increase blood pressure. When that happens, renin also promotes the release of another hormone called aldosterone, and this comes from the adrenal glands. So now you can see the kidneys speak into the adrenal glands here, right? So so in Chinese medicine, before the advent of anatomy, they knew something, that those two were closely connected. And aldosterone causes the kidneys to reabsorb sodium and water, and this and if you reabsorb sodium and water, wherever sodium goes, water follows. You increase blood volume and pressure. All right. So vice versa, right? If you're getting rid of sodium, right, a lot of diuretics work like this, then water follows, and you will lose water. So you get this diuretic effect. So that speaks to water balance also. When dehydration is detected in the central nervous system, specifically the pituitary gland, there's an antidiuretic hormone secreted by the pituitary gland that causes the kidneys to retain water instead of getting rid of water. So it's closely connected to the central nervous system. And then we talked about like hormone secretion and activation. One of the main ones is vitamin D. So we can activate vitamin D through the kidneys. Most people with chronic kidney disease are very low in vitamin D. There's studies that show that having optimal vitamin D helps the kidneys function more optimally. The other hormone is erythropoietin. This is the hormone that signals bone marrow to produce new red blood cells. So you can see if the kidneys are damaged or having issues, you may also be affecting the production of erythropoietin from the kidneys. Therefore, the bone marrow is not producing enough red blood cells. Therefore, guess what? You can become anemic. So this is something that a lot of primary care physicians don't even connect here, right? They think, oh, okay, Well, anemia, and we did a couple podcasts on this, we just think of it mostly as more, most PCPs as like, oh, it's either a iron deficiency or B12 folate deficiency. But the kidneys play a big role in that. So you can see it in chronic kidney disease. Sometimes it shows up sooner than later. And so it can, it's a telltale sign that something's going on. And you'd find that on CBC. And then renin is the other hormone. So there's three hormones the kidney is known to secrete, and I'm sure in the future we'll find other ones that it also does. But renin again is the essential part of the renin-angiotensin system, and it just helps regulate sodium fluid levels and blood pressure. The other thing the kidneys do, based on all its filtering action in conjunction with this hormone, is maintaining a pH balance. This is pretty important here because the urine likes to be slightly alkaline. And if you eat a relatively healthy diet, it tends to be. But if you are eating a diet like the SAD diet, the standard American diet, high animal protein diet, sugary foods and so on, you are going to get more of an acidic urine there. Over time, that puts a lot of stress on the kidneys, and then it becomes like a snowball effect. As the kidneys get stressed, now it can't do pH balance, and you become more acidic. If you continue eating a poor diet, you get more acidic also. And so it's like this circle that you just keep going through, and then what you see are you pass through these different stages of chronic kidney disease, and we'll go through them 1 through 5. And at 5, you're at kidney failure. That's where you either need a kidney transplant or you need to be put on dialysis. The other thing kidneys do is waste excretion. Specifically, you can think about nitrogen, getting rid of that in the form of urea from the breakdown of proteins. It gets rid of toxins. You're filtering the blood, so it's getting rid of toxins there. Drug metabolites. A lot of drug tests are done looking at the urine based on that. We actually talked about it, a test that we do, just looking at the urine, which is the urine organic acids test. And this is just looking at body metabolites and seeing, getting an indirect measure of how the biochemical pathways are running based on your metabolites in your urine. And then glucose production is another biggie for the kidneys, right? So a lot of people don't realize this, but the kidneys, liver, and the intestines are able to produce glucose from non-sugar compounds in humans. They're the only organs that are able to do that. So like after an overnight fast, the kidneys produce about 1/4 your glucose, which is released into the blood. So that's pretty neat.
Yeah.
So that's another reason. So you're talking about the kidneys playing a big role in glucose balance, and but also if your glucose is out of balance, you're, as far in terms of being diabetic, your kidneys are going to be the ones that suffer. So we're talking about chronic kidney disease, and so what does that actually mean? It's basically, just to reiterate, it's a progressive decline in renal function, and it's mostly demonstrated from a Western perspective by looking at the glomerular filtration rate. And if it's under 60 for three or more months, you're pretty much going to be diagnosed having CKD. And when that happens, you get a buildup of waste products in the blood, electrolyte imbalances, possibly anemia, and you get some wonky blood labs, like albumin and creatine ratio may also be off. And we'll go over those actually in just a second here, just so people can get an idea when they're looking at their blood labs, what each one of those things kind of mean. Let's see. One thing I also wanted to, we talked about this before, but acute kidney injury, right, can also lead to CKD if it's not taken care of. And what would that be? That could be like a sudden reduction in blood flow to the kidneys. It could be a UTI that is untreated, where the infection goes to the kidneys. That's why it's very, very important to treat that right away. Also, what about kidney stones? We did a podcast on that one, right? And this
Right.
is one of the things. So kidney stones blocking the urine where you get back up in there can also lead to chronic problems. And then somebody who's just a stone former and making a ton of stones and not changing things to alleviate that, it can also compromise the kidneys and also lead to CKD. But the main factors that compromise kidney health are that I see in my clinic most of the time are diabetes and hypertension. So, and guess what? The nice thing about diabetes, especially type 2 diabetes, it's very, very easy to treat, especially in the early stages. It's
Right.
funny. I just had a patient who came in. Gosh, it was like 4 or 5 months ago. But anyway, they had a hemoglobin A1C of 9 or maybe it was 10, and he just got his diagnosis of diabetes. And I put him on our fasting protocol that we talked about, Bryan, and then also recommended metformin, but also just made some dietary changes. Within 3 months, he went from I think it was a 9.4 hemoglobin A1C all the way down to 5.5. So he was no
Wow.
longer diabetic. So, and his doctor just could not believe it, didn't even think that was possible. But it's very possible. I've seen it over and over again with just making some simple lifestyle changes that really are as simple as, okay, put space between your meals, don't eat so much. I mean, it's as simple as that. And
Yeah.
that takes a tremendous amount of stress off the kidneys just doing that. So anyway, so as I indicated there, hemoglobin A1C is one of the ways to assess um, diabetes. If you can lower that in both type 1 and type 2 diabetes, you're helping preserve kidney function.
Mm.
Um, with hypertension, again, that's probably the second leading cause, diabetes being the first. High blood pressure is present well over 80% of patients with CKD. And if it's not controlled, it will lead to end-stage kidney disease. And there are drugs, certain drugs that can really, really help with that. That seem to have both for diabetes and then also for hypertension, that seem not only to work by lowering sugar levels, but also seem to have a really beneficial effect on the kidneys, right? So one particular drug here for hypertension is telmisartan, and it has renal benefits beyond blood pressure. So it's one of these drugs. It's classified as an angiotensin 2 receptor blocker, or ARB, but it really seems to help control blood pressure, but also has beneficial effects on the kidneys besides doing that. I think the common name is called micardis, I think. Yeah, MICARDIS. So that's a really neat, that's a, I know we're not big on touting prescription meds, but that is a prescription med that really does seem to have some neat beneficial effects for the kidney. And then as far as diabetes go, besides the standard, like most people gets diagnosed with diabetes, metformin is kind of the first go-to drug there. But there are drugs for diabetes called sodium glucose cotransporter 2 drugs, SGLT2 inhibitor drugs. One of the main ones is called, I'm going to screw this name up, but it's dapagliflozin. I think it's for IGIA. Anyway, that drug and similar drugs like it seem to go way beyond controlling blood sugar, but actually have like metabolic beneficial effects on the kidney. So those are things that people may want to just talk to their doctors about with that,
Hmm.
and just get reassessed if CKD is an issue.
So to clarify, Keoni, because you have mentioned you've used this a few times, like metabolic kidneys are very metabolic active. When you say that, can we think of, What's a good analogy for the everyday person that we can think of? Is this like the kidneys operate at a really high RPM? They use a lot of
Yeah,
gas
you can.
mileage type of thing, or
Yeah, well, you get a lot of blood volume coming through the kidney, so that's one way you can think that it's metabolically active. Also, you have a lot of the detox enzymes that are located in the kidney, right?
Mhm.
So it's very metabolically active there also, and um, and then you also are the kidneys also help aid in gluconeogenesis. So it's one of the organs that, like the liver, I classify, and the brain, where it uses a lot of energy to stay healthy.
Okay.
So that's the way you can think about it. And a lot of times you get, when people say an organ is very metabolically active, a lot of times you get this measure based on the blood volume that goes through the kidneys or through the organ in a day,
Okay.
that is necessary. So
You can see why the kidneys be high on that list then.
yeah. I mean, it's kind of, it's a little bit of a misnomer, right? Because
Sure.
everything's related. So
Sure.
you can't, you can't have healthy kidneys with the unhealthy gut, and
Hmm. Hmm.
vice versa. It's all related. And we'll talk about the gut kidney association here in just a second, which I find fascinating. It seems like, the gut, when that's compromised, all the organs kind of suffer for that. um One of the big things that's related to diabetes, but it's not always so, is obesity. So, of course, obesity is a risk factor for CKD. It's an independent risk factor for diabetes or hypertension. So, if you're obese, the kidneys have to work harder. They're under more stress there. Um, Metabolic syndrome, insulin resistance, again, kind of related to diabetes, but also they're different in a way. But these things can also um, have a negative effect on CKD. Um, this is something that a lot of people don't realize, is hypothyroidism. This is kind of fascinating to me, because the thyroid also, in medical school we were taught it's like the metabolic master gland. It's kind of in charge of running things at their appropriate metabolic rates and things like that. When you have hyperthyroidism, you get a lot of bone turnover, you get a lot of medically active things going on that are just really revved up. Well, with hypothyroidism, everything's kind of revved down, and it does seem to have a negative effect on kidney function. So it decreases renal blood flow and filtration, sodium reabsorption, and it also seems to be, hypothyroidism is correlated, or it seems to be related, associated to the progression of CKD. So this is one of the reasons why people who are hypothyroid, and I've heard this before, they'll say things like, well, it's not going to kill me if I don't take my thyroid medication. Certainly not like hypothyroidism would, right? Like, you definitely need to take your medication with hypothyroidism, or if you don't have a thyroid, you definitely need to take your thyroid medication. But people who have a thyroid and you're getting some function there, but are not getting it into the normal levels, it can affect the other organs, like the kidneys, in a negative way. Um, so I bring that up because, it seems like I can't tell you how many, especially women, are diagnosed as hypothyroidism, especially around menopause. It seems like that's a thing that goes there. And I just tell people that it is important to keep your thyroid gland happy, because it makes other things like your kidney happy.
Right.
Um, Age and race definitely play a role. There's definitely a genetic component there. People of African descent are at greater risk for kidney disease. Um, and of course, we said one of the biggest risk factors of CKD is the older you get. And besides NSAIDs, as far as being a problem for the kidneys, um, it's kind of interesting what they do. The effect is basically a reduction in the synthesis of prostaglandins. And these are cell signaling molecules derived from omega-6 fatty acids like arachidonic acid. Well, one of the things and that's, which is also related to omega-3 fatty acids, right? So one of the things that you, just hearing that, you think, whoa, well, maybe taking EFAs or omega-3 fatty acids like fish oil can also help the kidneys, or maybe offset some damage from NSAIDs. And that is true. So that's why, a lot of my well plans, I will tell people, you know, I usually across the board will recommend like a good multivitamin, but also on top of that, I usually recommend fish oil because it's so wide ranging and the beneficial effects that it has on the body. But people who take NSAIDs should also probably be taking something like fish oil to offset any negative effects from that. It's very, very important to not overdo NSAIDs because the kidneys will suffer. And again, acetaminophen and NSAID toxicity are one of the main causes of CKD. Now, there are other drugs out there, of course, chemotherapeutic agents. Kidney toxicity is a common side effect of chemotherapy. Cisplatin, adriamycin, these things can have devastating effects on the kidney. There are some natural therapies that you can do to kind of offset these effects. One of them being CoQ10, which is also beneficial for the kidney. Certain antibiotics like vancomycin is extremely nephrotoxic, detrimental for the kidneys. There are others also. For a lot of my patients who are going in for any type of radiant contrast thing for imaging, where that contrast has to be filtered through the kidneys, I will definitely recommend some natural therapeutics also, like NAC for them to take to prevent any kidney failure. Contrast-induced nephropathy is the third most common cause of hospital-acquired kidney failure. So how do you like that? I mean, that's pretty awful. You know, you're going in for imaging and then all of a sudden you get your contrast and, you know, you have kidney failure. Well, you can offset it. And by taking certain things that can protect the kidneys, like NAC, and acetylcysteine. And we did a whole podcast on that. You know, it was under our glutathione podcast. And again, it just speaks to the, you know, that it's a very, very powerful antioxidant and will protect the kidneys.
Keoni, just to clarify with the NSAIDs, like non-steroidal anti-inflammatories, ibuprofen over the counter type stuff.
Yeah.
With acetaminophen, it also affects the kidneys, because I just thought that one is the liver because it's not an NSAID. But you definitely know more in this world than I do.
It will also affect the kidneys too. It has to be metabolized through the liver and kidneys. So when the kidneys are overwhelmed with too much of that stuff, Tylenol, acetaminophen, it can definitely damage the kidneys.
Okay.
Also, not and the liver. And you know, so think about, you're talking about your two main detox organs there.
Yeah.
And so
that makes sense.
Yeah.
But now ibuprofen would be worse on the kidneys, I would assume, because that is a non-steroidal anti.
You know, they're all
like, is there something about the NSAIDs and, like, for instance, like a corticosteroid or something like that could also put people
it's the way it affects the prostaglandins in the body and how they're, you know, those are produced, catabolized and anabolized. But I don't know if I would say one is worse than the other. I mean, they're both pretty bad, especially if you're overdoing them, and you're taking them at a dose for longer than you should. And I think it's really important that we do talk about this, because a lot of people do that. Like there's like a halo effect with a lot of stuff you get over the counter.
Mm-hmm.
You know, people will get stuff over the counter and think, well, you know, I get it over the counter, and not think that because doesn't require a prescription, that it's probably you know, less harmful than other prescription drugs. And that's not true.
Right.
You know, this halo effect can get you into a lot of trouble. And it's very important because sometimes you could damage the kidneys so much in a short period of time, and you can't get that function back a lot of times. So that's why I think it's good that we're harping on that.
Well, and then it leads us back to what you're talking to about right now, but things like NAC, and then what other things can, you know, I suggest, because obviously, you know, if I see someone total knee replacement, total hip replacement, they're taking a lot of this stuff at one time, just like the example you gave me.
Yeah.
And so what types of things can they do to combat it? Staying hydrated. It definitely seems like the NAC and
anything that is gonna produce more antioxidants in the body is a big thing, or decrease inflammation. All right, so NAC is a big one, and we'll talk about these in a little bit, but the main things that I really want to do for kidney health for my patients is I want to make sure their vitamin D level is appropriate. It has a strong protective effect on the kidneys, omega-3 fatty acids, CoQ10 protects the kidneys, but the thing about it is CoQ10 has also been shown to help lower blood pressure. So if blood pressure is an issue, I put people on that. N-acetylcysteine, and then my favorite anti-inflammatory that doesn't have any detrimental effects that we know of is curcumin, and it seems to have a beneficial effect on the kidneys also. So
Right.
those would be the main things. And I want to talk about the gut kidney connection also, because that is something that is also important. And when the intestinal microbiome is perturbed, you get this kind of label of dysbiosis, and when you have dysbiosis, you get these uremic toxins, and there's a specific one called p-crysyl sulfate, and it can accumulate in the kidneys and promote CKD. And then also it can also promote insulin resistance, which also, when you are insulin resistant, you are also creating more pressure on the kidneys, because more insulin around your kidneys help reabsorb sodium. Water follows sodium, you get higher blood pressure. So the more insulin sensitive you are, the lower your blood pressure. But anyway, if your intestinal microbiome is perturbed, that's a neat, well-known mechanism for how it can cause chronic kidney problems. Well, I mean, so what do you do to help solve that issue? Well, one of the best things you can do for that, and they have studies on this that specifically look at this toxin, is pre and probiotics. I mean, how simple is that? And that's been shown, as long as your gut health is good, there's a strong correlation that your kidneys are also healthy. So that's a pretty neat relationship between the kidneys and the gut that most people wouldn't realize off the top of their head. So again, so you can think about pre and probiotics, even though they're typically known as gut enhancing supplements or nutraceuticals, they are also can be kidney enhancing nutraceuticals. So those are the main things, but we'll talk about those in a little bit more detail in just a second here. But I guess one of the main things I go over with my patients a lot is like, how are you monitoring kidney health? What are the labs that people are looking at to monitor that?
So Keoni, is that what you would, the list we just went through, the vitamin D, getting all the way to the curcumin,
Yeah.
is that what we're suggesting as general kidney health improving stuff? And then in the same vein, I want to just clarify, when I get that patient who has total knee replacement, they're going to be taking ibuprofen. Definitely want them to be doing all these other things. They're going to be taking stronger drugs. There's no doubt about it.
Right.
What, if anything, can they take or do in that high load moment where they are going to go through a week or two of taking these drugs quite a bit and having to metabolize it?
Yep.
What can they do in that short term, assuming they've got that list of 7, I think it was, kind of clarified out and got their I's crossed and their T's dotted,
and even before they get to the nutraceutical thing, it's really about, the first thing is making sure they're not overdoing those drugs, right? Like they're taking them as prescribed. That will reduce tons of risk. Because again, there's a halo effect. Some people will overdo it. They just think they have pain that they're not taking enough, and before they know it, they've overdone it. The other thing is staying hydrated. Make sure you're drinking enough. And then the other thing is to make sure that whatever other drugs that you're on, and this is something that their doctor has to do, are not interacting in a negative way also, and potentiating a negative kidney effect. All right. Now, once you do that, like if I had to give like one main thing, besides that our foundational stuff that we talk about, the multivitamin and the fish oil, the main thing I would say to help protect the kidneys, I would probably think, let's look at N-acetylcysteine. It's cheap. There's been studies, people taking 600 milligrams twice a day. help protect the kidneys from all kinds of insults, and seem to help reverse damage that of CKD. So you get some reversal symptoms. That would be one of the main ones.
Yeah.
And it's really meeting the patient where they are, because I could go on, and I didn't even talk about half the stuff that you can use for kidney health here. I just don't want my patients, and I know you're this way too, taking a ton of pills and potions, and we just want to give them the most bang for their buck. I mean, if they're in pain and they need their NSAIDs and stuff, we'll just follow them, make sure they're doing it appropriately. And if they need it long term, one of the best ways to do that would be, okay, let's just make sure that everything's going good. Let's do some blood tests to just see that your kidneys are doing okay, or that your liver function's doing okay doing this,
Yeah. All right.
taking
So
these drugs.
yeah, you're about to get into the blood
Yeah,
test.
yeah. So one of the main blood tests is the glomerular filtration rate. It's the GFR, and it's the most important measure of kidney function. And in fact, for CKD, it is the most important. And we basically stage CKD off of the GFR. And the stages of CKD are stage 1 through stage 5. Stage 1 being where you have mild kidney damage. You may see some aberrations on blood labs, but nothing out of the ordinary. Most time your doctor may not even take a second look at that, all the way through to stage 5, where that's the most severe kidney damage, and the kidneys are very close to not working, or they've stopped altogether or failed, and at that point you need to have dialysis or a kidney replacement. The earlier you catch CKD, the better. And a lot of people can be in stage 1, 2, and 3 and never progress to stage 4 or 5. So this doesn't mean you're ultimately going to progress there, especially if you get your lifestyle stuff in order and are supplementing and taking the right meds and doing it in the right doses there. Anytime you see a decrease in GFR, and this, we talked about age, and this decrease happens with age, especially with renal disease. It's higher in men, higher and also the GFR can be also higher in pregnant women, and then in some other disease states like what we talked about above. So that's the GFR. That's the main blood test I look at. And then there's another. Then we look at creatinine, and then we also look at blood urea nitrogen. And creatinine it's just a breakdown product of phosphocreatine, which is the energy that your muscle uses for explosive type movement or work. You'll see higher creatinine levels in like bodybuilders and things like that. So you just have to, sometimes you see them pretty high there, and that doesn't necessarily mean it's a bad thing. So you just have to meet the patient where they are and understand what they're doing. But one of the main things is to help keep those levels down is make sure you are drinking enough water and not dehydrated. Blood urea nitrogen, as the term is implying there, it just is a measure of the waste products of nitrogen or as urea in the blood. So you want to make sure that those levels stay appropriate. One of the things I want to bring this lab up, because a lot of primary care physicians don't know about it, and it is a pretty important marker for kidney function, but it's not run a lot. I'm actually going to start putting it on my well plan as one of the anti-aging blood labs, and it's called cystatin C, and it is a pretty good marker of kidney function. It seems to be it seems to take out some of the ambiguity of like looking at the other markers. So cystatin C, it's less influenced by age, gender, body composition, diet. I mean, it gives you a good marker that you can kind of hang your hat on, instead of saying, well, maybe this or maybe that. Especially if you do cystatin C in conjunction with the other ones, you get a really good idea of how well your kidney function is. Doctors are starting to use this, but it's a great predictor of kidney function, especially in elderly patients. So I think it's going to be one of the main things. The higher it is, it's strongly associated with thromboembolism, venous thromboembolism, It's a promising predictor of cardiovascular risk. So you get a lot of information with just that blood test alone. The other things you'll see on a regular blood lab are electrolytes and albumin. Again, if the kidneys are not functioning up to par, you'll see electrolyte balance being off. You'll see more, you may see the albumin level off also. Albumin is just a blood protein, and it can be lost. It can be lost in the urine quite a bit, especially when there's certain types of kidney disease. Another anti-aging lab that I really like to run, blood lab, is homocysteine, and it's kind of generated as a byproduct of protein metabolism. But anyway, elevated blood levels of that are associated with cardiovascular risk. That's the main reason why I run it, but it's also highly correlated with GFR. And you see high levels of homocysteine in people with end stage kidney disease. And so this is one of the things that can be mitigated or slowed down by just taking B vitamins and some other supplements that can help lower that. Also, a plant-based diet, which is very healthy for the kidneys, is one of the things that will also lower homocysteine levels. You can think about it as like a blood toxin for the kidneys. The higher it is, the worse the CKD. A complete blood count, as we implied, also is a good thing to kind of assess the kidneys. It's an indirect measure, but especially when there's anemia or red blood cells and you can't think of any other cause, you may want to look at the kidneys there. And then a urinalysis, doing a dipstick, is it dumping protein? There's a kidney condition called nephrosis, where you're dumping a lot of protein. I actually saw this in a patient of mine. She's doing great, but she actually had, every time she urinates, it's like she's urinating a frothy, like bubbly, soapy mix, and basically her kidneys, it's nephrosis, and it's just dumping a lot of protein. And there's a lot of causes to that, but also that can also fall under the rubric of CKD if it's not taken care of or addressed.
Right.
You just want to make sure that the kidneys are doing the appropriate output too. You get an assessment of that with the specific gravity and osmolarity of the urine. Urine output, the volume, all that stuff will tell you when you do urinalysis and give you an idea. These are very simple things that you can do. Also, with that dipstick, you can get an idea of metabolites. It's a quick measure to look at your kidneys. Imaging, we talked about on our kidney stone podcast. I mean, if kidney stones are involved, which can also contribute to CKD, you can also see some of that on imaging. And then, of course, blood pressure is another big issue. And if you have electrolytes off, it can also affect the heart, right? So sometimes an EKG can be done or gives you more information. All right, so let's just talk about how can we preserve kidney health. All right, and then we'll go into the supplements, and shouldn't take us much longer. I think avoidance of non-steroidal anti-inflammatory drugs. Speaking to your patients, if they can get away with taking curcumin and lower their use of NSAIDs, that's a great thing. I've done that with my patients. I'm like, I usually tell my patients, you can take NSAIDs, you can also take them along with curcumin. I wouldn't take them at the same time, but I would take them at least an hour or two apart. They may inhibit absorption of each other, but usually when you take them, you can reduce your load of the non-steroidal anti-inflammatories. And a lot of people, when you talk to them about it, and they know about it, they will start reducing their dose and do it no problem at all. Another question I get is, what about aspirin? Well, aspirin is something else that, as far as kidney health is mixed. There are some studies that show that it could be detrimental. I just want people to not be dependent on any type of, pain drug or anticoagulant drug if they can help it. So if they can reduce that, I definitely do that. Western style diet is the worst for kidneys. Probably the best diet for kidneys is the Mediterranean diet, and or the DASH diet. Those are the two diets that have the most um, research that show benefit for the kidneys, and of course, they also show benefit for longevity. These are both plant-based diets. They're not particularly diets that are restrictive by any means. Even on the Mediterranean diet, moderate alcohol is assumed to be part of that diet. You just get a decrease of red meat and of refined carbohydrates with that. And then the DASH diet is just a diet that was basically developed to stop hypertension. And again, that's a diet that its emphasis is on vegetables, fruits, low fat. It's fat-free dairy products. It includes fish, poultry, whole grains, nuts. It's a generally healthy diet. It limits sodium and it limits the sweet stuff. And anytime you can control blood pressure, you're going to help your kidneys. And not only that, you're going to help your cardiovascular system. So we want to make sure the electrolytes are in balance. Anytime the kidneys are compromised, you can get really low electrolytes, like you can get low or high potassium levels. A lot of times potassium levels are closely monitored with chronic kidney disease. If you go too much over or get too much, it can cause heart issues. So you just really have to kind of watch that. Generally, if you eat a relatively healthy diet and you don't need to be that restrictive, it's not that big of a deal. I put more emphasis on restricting your simple carbohydrates as far as helping maintain your kidney health. What else? Oh, this is a big one. I'm surprised you didn't bring this up to me, Bryan. Anytime there's you've heard this from a lot of people that protein restriction, you want to watch your protein intake because it could damage your kidneys.
Mm-hmm.
Well, you definitely need to restrict or watch your protein intake with damaged kidneys, right? But high protein diets have not been shown to damage kidneys. So if you have CKD, yes, you do want to make sure that you restrict your protein, because again, it makes the kidneys work harder. And the DASH diet and the Mediterranean diet help you to do that.
But your 2 scoops of extra whey protein are not going to damage your kidneys.
No.
Yeah, exactly.
For a healthy individual, no.
Right.
No. I mean, your 4 extra scoops of protein is not going to damage your kidneys at all. The main thing with athletes, the main issue that I would say for them is watch your NSAID intake and make sure you're drinking enough water.
Mm-hmm.
Don't get dehydrated. So yes, protein is not one of those things that you have to worry about damaging your kidneys. But if you already have CKD, yes, then you do have to worry about it. The average protein intake for individuals with CKD, I think they recommend like 0.55 grams per kilogram a day. I think that translates, you got to check my math on this, like a quarter pound of protein per pound of body weight, maybe. I think that's about right. So what would that be? 200-pound person probably should not go above 50 grams of protein a day. Anyway, I check my math on that. Okay. Let's see. One of the things about minerals also that I will use. So sometimes with CKD, you are running in metabolic acidosis, right? So your blood is slightly acidic. One of the ways to offset that is taking like a base form in salt, like potassium citrate, sodium bicarbonate, even magnesium to some extent, and that could help balance out that pH, your blood pH and your urine pH. So that's something I'll do if it's an issue there. Again, you have to watch potassium intake though, right? So if the kidneys are really compromised, you have to follow that closely. A form of B vitamin, peroxidal 5-phosphate, it's a form of B6. This is really powerful. It's in my multivitamin that I use specifically for diabetics, and that's pretty much what it does. It helps. It's a potent inhibitor of AGEs, or advanced glycation end products. And if you can do that, and you have a multivitamin that has that in there, you especially with diabetes, you're helping protect the kidneys. So with diabetes, that is a must. I usually use a diabetic multi that has that in there. Vitamin D, we talked about that in studies. It's been shown to help lower protein loss in the urine, right? With kidney disease, see high protein output. It lowers the albumin to creatinine ratio, and it improves heart function. I mean, what else? It improves immune function too. So there's many things that it does. It suppresses kidney inflammation, and inhibits cell death, and it protects against toxicity from certain chemotherapeutic drugs. It also probably protects against toxicity from everyday toxins we get in our food, water, air, and so on, which a lot of that has to go through the kidneys. One supplement that I think should probably be standard for people who are going through dialysis specifically is L-carnitine. And L-carnitine is one of these carnine nutrients that is found very high in meat. But it is one of these things where, if you're going through dialysis, you lose a lot of carnitine, and this condition can exacerbate anemia, and by losing carnitine can exacerbate anemia. It can exacerbate cardiomyopathy if you lose carnitine, and muscle dysfunction, and overall just feeling awful and extreme fatigue. It's very, very safe to take. A meta-analysis of 49 trials, including like 1,700 kidney dialysis patients, found a significant decrease in C-reactive protein. It's a marker of inflammation. And those taking carnitine. Anytime you have a lowering of that, you decrease in inflammation there. And this was done. A lot of these trials were done with intravenous carnitine, but also I use oral carnitine, which is easy to do. It is one of the things I generally recommend to all my CKD patients to take a little bit, but I feel like it is an absolute necessity for going through dialysis. Of course, talk to your doctor, but I generally recommend it on my well plans for that. We talked about CoQ10. I mean, you're not going to go wrong with that. It definitely lowers oxidative stress. It is one of these things that helps keep blood pressure low. What else? And then also one of the things that a lot of people don't know, any type of nephrotoxic drug, any type of drug that kind of like what vitamin D and NAC does, any type of toxin that the kidneys are trying to metabolize, like chemotherapeutic drugs or NSAIDs, you want CoQ10 on board to help you with that. We talked about omega-3 fatty acids. I won't really talk about that. We talked about pre and probiotics and the gut-kidney connection there. And then my all-time favorite is N-acetylcysteine. It's a sulfur-containing compound. Anytime you have a sulfur-containing compound, you can think about that as a detox type of nutraceutical. And again, it protects the kidneys. It also protects the kidneys from any type of toxin that's going on there, and it will lower any inflammatory markers also. I won't really go into magnesium. We did a whole podcast on magnesium. We mentioned numerous times throughout numerous podcasts. So it's a big deal. Vitamin D is another one. I usually just have it packed into my multivitamin for my patients. Those are kind of the mainstays, and then some of the other things that a lot of people don't know about, including naturopathic physicians, they don't use unless maybe they're trained in Chinese medicine. But there are herbs out there that help protect the kidneys. One of the main Western herbs is milk thistle. It also protects the liver, but also can protect the kidneys. And the other main one that I think is a great herb that also lowers inflammation, we talked about, is curcumin. And then the other things, you're certainly not going to go wrong with green tea. EGCG, we talked about a lot on numerous podcasts, but that also has been shown to help protect the kidneys. But before we end, I want to mention some of the Chinese herbs. I won't go into too much detail on this that people want to kind of think about. There are some Western nutraceuticals that also use some of these Chinese herbs. But in Chinese medicine, one of the main herbs that help protect the kidneys are the mushrooms. And so the two main mushrooms that I use in the formulas, there's a formula I use called Wu Ling Sun, and it's a common name for that is called Poria 5 formula. Anyway, it's packed full of mushrooms, and one of the mushrooms is Poria called Fu Ling, and another one is called Polyporphis umbellatus, and that's Zhu Ling. And these things just in the studies, it seems to just overall optimize kidney function. And then I use another one that I use that is fairly common. It's by a pretty big company, nutraceutical company here in the U.S. But the formula also has it's called, I think one of the names is called Kidney Correct, but one of the mushrooms in there is called Agaricus bisphosphus, and that mushroom is just white button mushrooms. These are mushrooms you see in your grocery store. Anyway, they make an extract out of it that seems to help maintain kidney function. It's packed with some other herbs in there like red ginseng and astragalus that also seem to help optimize creatinine and also help to optimize blood urea nitrogen. So those are things I'll use for people that, you know, the kidneys are very sensitive organs. So you really want to make sure if you're taking something that you're going to somebody who's kind of qualified
Right.
and knows about it, because even when your kidneys are compromised, just overdoing protein can make it worse, and a lot of people don't realize that. So even so with nutraceuticals, you want to make sure you're doing the right thing.
Yeah, absolutely.
Anyway, that's kind of the stuff. That's basically everything I wanted to go over. Is there anything you wanted to add, or did
Stay
we miss anything?
hydrated.
Well, yeah. I mean, that's a big deal actually right now, especially with the heat that we're dealing with.
Yeah.
People don't realize how important that is. But also, speaking to that, the older we get, we do lose that thirst mechanism. And the older we get, age is a main risk factor for CKD. And so you're just adding to the nonsense, so to speak, by not drinking.
Yeah.
So
Don't let your risk factors become problems,
yeah,
which is what I'm saying. I see with it. It's like, okay, hypertension in their 30s, and then you see it. And it's just,
yeah, right.
I don't know why it hit me like a ton of bricks as you were going through it. Just
Yeah,
how many times with these CKD patients, especially the ones that, I can see some real bad people in bad shape, real bad shape, people that are in
right.
real bad shape. As they come into various different clinic settings, especially depending on, what type of setting that is. And all these things really do follow each other. And
Yeah,
obviously
they do. And the other thing that I find kind of disconcerting is when somebody has CKD, whether they're at stage 1 or stage 2, which a lot of docs that seem to ignore, they really are not getting this information that we just talked about. It's just like, okay, you have CKD, you're fine right now, we'll check you in a year. It's really, you ought to start instituting some of at least the lifestyle stuff like right away to preserve kidney function.
yeah.
And unfortunately, their doctors, either out of ignorance or time or whatever, don't really go into kind of this information that we're talking about. I mean, as simple as, and then being really proactive in protecting your kidneys. Like if you're going in for a contrast for
Mm-hmm.
imaging and you have to take
Mm-hmm.
that contrast dye, well, how can you protect your kidneys? Well, NAC is a really simple way to help you do that,
Right. Yeah.
and
And
it's
it should
cheap.
just be on a paper on before
Yeah,
your
right. It should,
post-op
right.
call or whatever the case may
It
be.
should be. It should be, because
Yeah.
you're not going to go wrong with that stuff. So anyway, but anyway, yes. Anyway, thanks again for listening. If you guys have any questions or comments about this, we will do some other episodes on kidney function. We'll talk about probably in a future date, nephritis and nephrosis, which kind of can fall under the rubric of CKD. But we'll go into more specifics on what those diagnoses are and what that means. But anyway, thanks for listening to us again.
And be well. And if you are listening to us again, tell your friend to listen to us for the first time. And then we'll say hello to them for the first time on the next episode.
Yes.